very much. Very good morning to all of you. First of all, I would like to thank you, Fleur, and of course, DFAT for organizing this with us. And also, thank you for all DFAT support for TNP2K. We are very grateful for that. And Bu Yanti, selamat pagi. Pak Eko, selamat pagi. Dan Bapak Ibu sekalian hadirin yang saya muliakan. So, first of all, I would like to welcome you to this South-South Knowledge Exchange Forum. I saw people are coming from very far away. Some of you come from Latin America, Brazil, and so on. And from Africa also, South Africa, Southeast Asia. From Nepal. What I hate to come to international conference is that you fly 30 hours and then you talk only 10 minutes. This is... yeah. So hopefully bear with that, because it's a very useful conference. I'm very excited. I'm very pleased that I can see all of you here. It is a challenge for us to link social protection and employment. I think this is a very important topics. We want to listen from all of you about your experience, about what you have been doing in your country, and we'll be supported by Katrina. We will use the knowledge jam. I think this is very interesting. This is also new for me. So hopefully, all of this knowledge and information that you have, we can gather everything, and will be very useful for us. But before we start with that, because this is a very challenging process, I want also to share with all of you the experience of us. It's a very simple experience, because sometimes when you go to a conference, you talk about big things. But I just want to give you a flavor about something specific. Because the title is Social Protection and Employment Opportunities, how to link social protection and employment. Whether it is directly linked or it is a spillover. So I want to share with you all our experience. It's very focused, but even though its focus is implementation is not that easy. Because related to implementation, it means whether you like it or not, you got to deal with the political economy of the country. Yeah. So let me start with that. So this is our education level. You can see that nationally, our workforce, not only, but almost half of them are graduating from primary school and lower. Most of them even don't go to primary school. The one who go to university and get diploma, maybe only 12%. So I think the Indonesian in this room is at least they get university degree, and that's part of the 12%. So you are very elite here, Right. But more challenging, if you look at the 40%, the lowest, The number of people that go to primary school and below is increasing to 73%. This is the head of the household. So most of them, out of the 40%, the lowest, the education of the head of the household is only primary school and below. And more than 2/3 of them is never went to school at all. So I think this is a challenge that we need to address, how to link the social protection, especially education, so we be able to have a better workforce, and also making the poor can get access to the education. This is our composition of our population related to the consumption. So you can see, as many other developing countries, our distribution of income or consumption is skewed to the left. It means a lot of people living close to the poverty line. The blue one is the poverty line. So if something happens, economic shock, disasters, and others, they can be easily go down under the poverty line. So although our poverty rate is only around 10 to 11%, but the vulnerable is around 40%. Vulnerable 40% is consistent with the $2 PPP income. So almost half of the population is very vulnerable. So that's why, again, social protection is very important. Basically, the solution is simple. One is, of course, increasing their income for the poor. Secondly, reduce the burden. This is the social protection. So we have the targeted social protections for the poor, for healthcare, education assistance. This is what I'm going to share with you today. We have conditional cash transfers. I saw colleagues from Mexico and from other Latin America. We try to mimic your CCT. And also we give rice for the poor, because rice is a very important commodity in Indonesia. It's 30% of the consumption of the poor. So if the price of rice increasing, no matter your program is good, but number of people will be living under poverty line. This is our social system. We have, I already mentioned, we have education assistance, we have conditional cash transfer, we have rice for the poor, but we have social insurance for health. So our health national system is run as a insurance base. But the premium for the poor is paid by the government. This is another session if you want to talk about health, but I will skip that. We have program, what we call it, the assistant education assistance. But it is turned out that only less than 10% of poor people receive that kind of education assistance. Yeah, some people said, yes, education is a public good, so it doesn't matter if the rich get that. But the fact still, it is aimed for the poor, but only less than 10% get that. So how we improve this? I think all of you know about this. This is the targeting options. Fleur already mentioned about our unified database. But the option is, of course, the first one is mean testing. This is what we do. You can also do what you call it geographical targeting. So no matter what, you just give all of the assistance to all of the population in one region. Yeah. Or we can use community-based targeting. Or we can use specific category to give the assistance. Or we can use what we call it self-targeting. But we try hard with this mean testing. It's not that easy. This is, for example, we can have this, beside the mean testing, we also have, specific vulnerable groups. We can define it. And the Ministry of Social define these specific vulnerable groups by iconic, like this. One is, of course, the fakir miskin, the bottom poor, orphans, street children, homeless without support, isolated tribal community, because we still have a tribal community in Indonesia, mentally ill, displaced population. So we can have a specific categories for targeting, and the Ministry of Social using this as a target. Self-targeting. I think 8 years ago, we subsidized our kerosene. Our kerosene is a very good quality kerosene. I mean, we call it a jet kerosene because, you just put a little bit additional substance and it become a jet fuel. And people buy it less than buying aqua. So it's very unfair. It's a very misallocation of resources. So we want to convert the kerosene to the LPG, to the liquid petroleum gas. So we design small bottles, only 3 kilograms. So only the poor that buy that, because the middle class, they buy the 12 kilogram. So this is a very small bottles for LPG. This is the unified database. Now we have the list by name and addresses for 40% the lowest of households in terms of welfare and economic condition. And 3 years ago, we give the cards and give this education assistance to the 25% the lowest. Our poverty line is 11%. We have the data for 40%, the lowest. But when we go to the parliament only agreed that the government gave only 25% the lowest. the assumption is already twice than the poverty line. But on the ground, you can imagine it is not easy because the 25%.1 household, I think they look the same. So on the ground, it's not that easy to explain this. This is our social protection card 3 years ago. Now we changed it with a Kartu Keluarga Sejahtera. We update the card every 2 or 3 years. Now we have a new card. And our by name and addresses is already linked with the Ministry of Home Affairs unique ID. So I think more than 90% of our names has the unique ID came from the Ministry of Home Affairs. It means most of our data is matched with the administration data from the Ministry of Home Affairs. So on one hand, I have the unique ID. It means the uniqueness is there. But on the other hand, the Ministry of Home Affairs also have the information about the welfare of the 40% the lowest. So this is the, with that data, we can map whatever you want to map. For example, this is out of our population. You can pinpoint up to the village level by name, by addresses for 40% the lowest. This is out of school children, age 13 to 15 years. You can pinpoint up to the village level. This is also our mapping for the participation rate for each kabupaten and compare it with the budget of the kabupaten itself. So we can pinpoint which kabupaten has the lowest performance but doesn't spend a lot of money for education. We go back to the social assistant, the education assistant. At the beginning, why it is only 10% of the poor household receive the education assistant is because before, the one who determine who will get the education assistant is the school. So it was school-based. So school proposed the name to the Ministry of Education. And of course, if the school proposed, first of all, it cannot guarantee whether they come from poor family or not. But it certainly guarantee that it not cover out of school children. Because a lot of out of school children, children which is not in the school system. So now, starting 2013, we changed to household based on, because we have this unified database. We work together with the Minister of Social to renew to update the name and the quality of the unified database. In 2016, we have 20.3 million students. And maybe you know that we have the national system, but also we have the education based on the regular system, which is under the Ministry of Education. But we also have the religion-based schools, which is under the Ministry of Religions. And the total of that is around 20 million that we give. We give the social assistance for 20 million kids, whether they are in school or whether they are out of school. And it is a challenge for us how to get the kids which is out of school. when we change the system from the school-based to the household-based, we improve the targeting, the accuracy of targeting. So as I mentioned, it's less than 10%. It's now increasing. After 1 year, it increased to 25%. It is not yet 100%, but at least it's increased twice. Is the school dropout level. Usually after primary school, they have a dropout. After junior high school, they drop out again, and only a few that get to the university. Even to the high school, it's very few. So we can move that chart because of better targeting. We increase the people who are poor to get more access to the education system. So we reduce this school dropout level because better accuracy in targeting. Our CCT also increasing the education. Compare with other countries which have CCT, what we are doing is not bad. So again, this is a very focused, also only giving social assistance related to education. Yet it's already very complicated to implement that. So it is a challenge for us. And now we have health assistant, we have other assistant. I think if we can focus to 1 or 2 social assistant, but you implement the program very well, I think that will be very useful. Ladies and gentlemen, Bapak Ibu sekalian, all of this research, what we have been doing is supported by DFAT. So I'm look smart because your support, Fleur. So again, thank you very much. And I think I would again welcome you and join the session. And if you have the chance, you can see the city. It's a very nice city, and most of you live in this hotel, right? Yeah. I think you can walk around and enjoy the city, and if you have a time, you can also enjoy other part of Indonesia. A very nice country. Hopefully you enjoy and you get fruitful discussion for linking social protection and employment. Again, thank you very much.